morning. I'm the oncology social worker from the Cleveland VA. And just to clear up that question about the non-veteran women that we serve, they're either married to a 100% service-connected veteran, or they're a dependent child of a 100% service-connected veteran. So that's how that happens. So I'm Jennifer Dimmick. I'm the oncology social worker from the Cleveland VA. And I did not, go forward. I did not put my objectives up on my slides because it's in our programs, but essentially I'm here to talk about how we implemented the distress screening in our VA. And just some points on the Cleveland VA. We're the third largest in the country. And we have complex cancer care, so we have vets coming from all over the state of Ohio to Cleveland to get their cancer care. And we have gotten high marks for quality within several different areas. Better Health for Cleveland gave us the gold star for our diabetes program and our high blood pressure program. And we also have 11 centers of excellence at the VA. And the program in which we started our distress screening is one of the centers of excellence that we have. So I will put that. So this is our service area. The Cleveland VA is here in yellow, Wade Park. So we service veterans from all over the state of Ohio, and then we also have veterans that come from Pennsylvania and West Virginia for their complex cancer care. And so the clinic in which we started doing our distress screening was a COE clinic, a Center of Excellence clinic that we received a grant from the OAA to design this clinic where we had interprofessional care along with learners. And so one of the things we wanted to do is pilot the different psychosocial standards. So we were doing survivorship, distress screening, and patient navigation within this clinic. And then we also wanted to show that it was sustainable so that we would be able to have this care go out to the different clinics within the VA. So, and that's what I was just saying, but I'm going to be talking about distress management. So this is what our clinic looks like. So we would have a veteran come and we would have these providers there so that we could see the veteran in one clinic visit. So we had social work and psychology, medical oncology. At the beginning of the grant, we had surgery there as well. And then we will stack up the appointments so that the veteran can either see radiology or radiation therapy all on the same day. So distress management, we are using the distress thermometer is the screen that we're using, which is the screen that is most popular throughout the country. What we were doing when we initially started this clinic is we were screening all patients that had a cancer concern, which we soon changed to just those with a diagnosed cancer, because what was happening is we were giving the distress screen to women who were coming in with a possible breast cancer, and that was, they were very distressed people, and they were all scoring high on the distress screen. So we actually changed the way we were passing out our screens to be an actual cancer diagnosis. So anyone who scores a 4 or higher was then seen by a person in our clinic. It would it would either be psychology, survivorship, social work, the medical oncologist, and then we developed a templated note that we put our screen in. So this is actually what the distress thermometer looks like. They can It looks like a pain scale, and sometimes the vets confuse it as that, but it's actually for distress, and anyone with 4 or higher is offered a visit right then. And there's different domains in which they can mark off. I'll show you on this next slide. So the practical problems and the family problems is, if they check off a lot on there, then I'll go in and see them and talk with them about transportation, finances, generally is what's the issues for them. The emotional problems is seen by our psychologist, and we do not have any, we don't have a chaplain in our clinic, but we will put in a consult so that they can see the chaplain if they should check off that, which they don't very often. But what they often check most on is the physical problems in fatigue and pain. And so what is nice about this screen is that the provider can use it and they can go over what their physical problems are right in the visit. So it's helpful for the provider. And this is what our templated note looks like. It's basically just translating that form onto a note in CPRS. That's the scale right there, and then individually all the different, what am I looking for? Let me go back. It's every one of these are put into that note, so it's actually quite a long note. And then this is some of our results. So this is from the COE clinic. People scored 92%, so they can check more than one thing, so this isn't going to add up to 100. So 92% of the people are checking off some physical problem. And again, the emotional is a little high there because we are doing benign breast. It did come down after a little bit when we screened them out. It's usually about 60% altogether for family and practical problems, and spiritual is quite low. I don't think the vets quite understand that question. We're going to need to look into reworking that question. And then we rolled this out to our lung cancer clinic, and they scored very high on their physical problems, which I expected with shortness of breath and pain. And then they are also quite high on emotional, which we expected that as well because a lot of our vets are diagnosed with lung cancer at advanced stage. It's pretty much the same for, around in the 60s for family and practical, and about the same for spiritual as well. So we were able to show that we could do the distress screening, and we were able to roll it out. It was something sustainable that we could do, and we rolled it out to the ENT clinic, the lung cancer clinic, and the urology clinic. And the process in which we do it, I actually skipped over saying how we did this. We're present for the lung cancer clinic and for the COE clinic. We're available to meet right then, but now as we're rolling it out to ENT and to urology, we're not actually physically in those clinics. So this is what we use to show the nurses how to contact us. So basically when a patient comes into, say, like the ENT clinic, the clerk will give them the screen, and then the nurse will review it, and if they score 4 or higher, the nurse can either page us. If it's more in the social work domains, they'll page me. If it's more in the psychology area, they'll page the psychologist, and we can come to the clinic at that point and meet with the vet. Or if the vet says they prefer a telephone call, what the nurse will do is they'll put it in the templated note, and then they'll tag me or the psychologist on the note so that then we know we need to call the vet and talk to them about what is distressing to them. So that's it. Any questions?
Thank you.